health, privacy, children's privacy, communication, and usability laws. So let's discuss a few laws in these regards here. And first, begin with HIPPA, Children's Internet Protection Act of 2000. HIPPA requires schools or libraries that receive discounts for internet access from the federal government. So not just everyone, those that receive some kind of subsidies from the government, to implement an internet safety policy that includes technology protection measures. The protection measures must block or filter internet access to images that are obscene, child pornography, or harmful to minors for those computers that are accessed by minors. That's HIPPA. Now, we also have COPA, which is Children's Online Privacy Protection Act. Once again, this is a federal United States law. It imposes certain requirements on operators of websites or online services directed to children under 13 years of age, and on operators of other websites or online services that have actual knowledge that they are collecting personal information online from a child under 13 years of age. It essentially identifies what a website operator must include in a privacy policy, how to seek verifiable consent from a parent or guardian of a potential children that may be using their services, and the responsibilities an operator has for protecting children's privacy and safety online, including restrictions on the marketing of those under 13 years of age. So if you are a kind of a website or app operator, you need to be aware and make specific modifications if you're serving children that may be less than 13 years of age. HIPAA. So HIPAA is the perhaps famous Health Insurance Portability and Accountability Act of 1996, the federal law in the United States that stipulates how personally identifiable information maintained by the healthcare and healthcare insurance industry should be protected from fraud and theft. And it generally prohibits healthcare providers. So it's applied to this term we're going to keep hearing, covered entities, from disclosing protected information to anyone other than a patient and the patient's authorized representatives without their consent. So anytime you go to a doctor's office nowadays, you have to sign a HIPAA agreement, which essentially is your consent to share your health information to related parties that may need it. Now, that you cannot just give your HIPAA rights away because the HIPAA rights are established in the law itself, but you can give consent for your information to be shared, for example, across health insurance companies or across doctors and so on. So there's two kinds of rules, and the privacy rule and the security rule. So the privacy rule is a set of regulations in HIPAA for the use and disclosure of protected health information in healthcare treatment, payment, and operations by the covered entities. So, and I keep emphasizing the term covered entities because does this include, for example, Facebook? So if Facebook has your data, your health information in it, because you're sharing your health information, personal health information with a friend over the private messaging, does Facebook have to monitor that personal health information according to HIPAA? Actually, I don't think so. They don't, because they're not a covered entity. They're not a healthcare industry. So HIPAA just doesn't apply to them, even though they are managing your personal health information. And you can kind of check out here more details on this privacy rule. There's also a security rule, which is more specifically focused on electronic protected health information and lays out 3 types of security safeguards that are required by those healthcare institutions to ensure compliance with the law. And these are administrative, physical, and technical. So on the administrative side, covered entities, once again, must adopt a written set of privacy procedures and designate a privacy officer to be responsible for developing and implementing all required policies and procedures. And there's going to be training programs and administrative functions that all show that they are actually administering your data correctly. There are physical requirements that need to be met in terms of the equipment that needs to be carefully controlled and monitored. Access to the hardware and the software must be limited to only authorized individuals and so on. And there's also technical requirements. So the system should not be used by an unauthorized person, protected from intrusion. When information flows over an open network, some kind of encryption must be utilized, and so on. So it's a fairly complex set of requirements for healthcare industries, entities to follow. The issue is that this concept of covered entities, which limits the application of the law to only certain kinds of institutions. Another important law here is the Section 230 of the Communications Decency Act. And you may hear a lot about this in the news and conversations about social media. Section 230 is a provision of Communications Decency Act, a U.S. federal law that protects internet service providers and website companies from being held liable for content created by users of their services, including false or defamatory content, and essentially reads, no provider or user of an interactive computer service shall be treated as the publisher or speaker of any information provided by another information content provider. So in other words, if you post something on tweet, you're like posting a tweet and blah, 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 and you kind of yell at someone and you say some bad thing, you know, Twitter is not considered the publisher or speaker of that information. You are. So it essentially removes the liability for the internet service providers like Facebook and Twitter from being held liable to the falseness or defamatory content that may be published on their sites. And all this, and there's debate on this too, and the Electronic Frontier Foundation, which tries to protect freedom of speech, I think they support this law. They said the most important law protecting internet speech, because, and if you think about it, there is a positive thing. If you have a website and you want to allow people to make comments on your website, you don't want to be liable for the comments that some random person makes on it, right? So, but of course, that also removes incentives from companies like Twitter and Facebook to monitor their content and remove completely false or violent or other kinds of problematic material. Now let's talk a little bit about usability and accessibility. So usability refers to the degree to which a system can be used safely, effectively, and efficiently. And now also nowadays, others have added while enjoying the experience. And I think this is a little bit of too much ideology here, but let's focus on the more sort of at least objective measures of usability, which is the ability for a person to use something, a system, a machine, safely, effectively, and efficiently. Usability is also discussed as accessibility, because if you cannot access, you cannot even use it. So if you don't have accessibility, you don't even have usability. And the systems can be an information technology system, it can be a website, it can be an IT application, it can be a machine or a process. And often you will see kind of examples of some poor websites that maybe look like this. The lights are flashing on your face and the letters are too small. But some of this is subjective, right? Because some of these characteristics are appreciated more or less by certain people. So the Americans with Disability Acts of 1990, ADA, does establish protections against improper accommodation for people with disabilities, and it applies to all kinds of government services, but also private entities as well, which essentially provide services to the public. And together with Section 508 of the Rehabilitation Act of 1973, these create a framework for creating the guidelines of how systems need to be constructed for people with disabilities, whether they are physically or impaired by not being able to walk or see or hear and things like that. Also, The web content accessibility guidelines exist, which are standards published by the World Wide Web Consortium, W3C, which is a nonprofit international organization, and the Web Accessibility Initiative, which have established guidelines for accessibility and usability of websites in particular. So they say that websites need to be perceivable. Users should be able to perceive all information in the content, including interface components. It needs to be operable, so users should be able to navigate and operate your interface component with ease and success. Of course, there is a degree there of how easy or how successful and so on, but that's the idea. Understandable, all information and interface elements should be easy to understand and operate. Content should be robust and reliable so that it can be interpreted by various user agents and assistive technologies. And we'll talk about a little interesting case with this as well. So these are some of the guidelines for usability, some of the laws that address usabilities as well and accessibilities. Let's talk about an interesting case here that involves actually the ADA and some of these concepts. So a plaintiff claimed that he could not order pizza through the Domino's company's websites, even with the assistance of his screen reader, as he was blind. The defendant's website, that is Domino's website, was argued was incompatible with this individual's assistive technology and ultimately violated ADA standards. Now, Domino's, the defendant, argued that websites are expensive to fix, and they also argued they're not under obligation to make their websites accessible for the visually impaired. And actually, this went all the way to the Supreme Court, and how do you think they ruled? Well, so actually, they refused to hear the case, and they left the lower court ruling standing in favor of the plaintiff. Okay, so actually, the plaintiff won, and it was agreed that Domino's largely inaccessible or unusable or poor usability website did violate ADA standards. And to partially to understand this, in US law, public accommodation can include both public and private facilities if used by the public. This may thus also include retail stores, restaurants, and other kind of facilities. So even though the ADA law is regarding public accommodation and certainly applies to government entities, it also establishes, it seems, that private facilities too need to make amendments or considerations for those with disabilities so that those with disabilities can use their sites and services at least with some degree of ease. That's it. We reviewed a lot of content in the set of lectures, and I hope this was useful to you. See you next time.